Hello everybody, this is Amrو from Egypt, Egyptian endocrinologist, and that's my new channel. Today we'll talk about a rare disease called Castleman disease. Castleman disease is a rare disease. This disease is described first by Benjamin Castleman in 1956, who discovered localized mediastinal lymph nodes with a characteristic unique pathology. Not like the lymphoma, it's lymphoma-like. It has a specific pathology, not like the lymphoma. What is this? Benjamin Castleman said. He was a pathologist. This disease is lymphoma-like, affecting lymph nodes mainly. It may affect the mediastinal lymph nodes, the neck lymph nodes, axillary lymph nodes, and any lymph node groups. It is divided into unicentric, affecting only one group of lymph node in the chest, in the neck, in the abdomen. And there is also extra lymphatic affection of the skin with violaceous nodules and sometimes the iron lacrimal gland. So it's like the lymphoma, it's like IgG4 disease. It is divided into unicentric and multicentric. Unicentric UCD and MCD multicentric Castleman disease. Multicentric, it affects multiple lymph node groups. It may affect the chest lymph nodes, the abdomen lymph nodes, cervical lymph nodes, so it's like the non-Hodgkin lymphoma. Unicentric affects only a single lymph node group or two groups maximally, and it's like the Hodgkin disease in clinical but not in pathology. There is association between the multicentric Castleman disease and human herpes virus 8. And so in a patient with multicentric Castleman, you should prescribe human herpes virus 8 and HIV, which is present in 50% of cases. Two viruses, human herpes virus and HIV virus. There is also association with Puym syndrome, and another syndrome called Tafro syndrome. Tafro means thrombocytopenia, anasarca, ascites and pleural effusions, fever with hectic fever, reticuline fibrosis, and O4 organomegaly. And so in multicentric workup, you should investigate for human herpes virus 8, HIV, Puym syndrome, and Tafro syndrome. David Fajgenbaum, a doctor, a physician, cardiologist, who is infected by it's not infection, who is affected by Castleman disease, and he starts to fight this disease alone. He found a cure for his disease. He was a physician, cardiologist, and Castleman disease investigation is like lymphoma. We do CT scan, PET CT scan, MRI, pan scan on the body to detect which region is affected. Is it unicentric or multicentric? The criteria for diagnosis is lymphadenopathy, 2 or more lymph node stages. This is a major criteria, and a pathology specific for Castleman disease. You need both lymphadenopathy and the pathology. Major criteria, you need 3 of 5. Thrombocytopenia, which is of Tafro, anasarca, fever, organomegaly, 3 of 5 supports the diagnosis. And you should exclude infections and malignancy and autoimmune diseases, Epstein-Barr, cytomegalovirus, lymphoma, rheumatoid arthritis, systemic lupus, hemophagocytic lymphocytosis. These all should be excluded. Surgical treatment, unicentric, you should remove this group, and so it's like lymphoma. It's like Hodgkin disease. Hodgkin disease, you don't remove, you give chemotherapy, but in here, you should remove surgical removal. The multicentric, you can give like non-Hodgkin disease, R-CHOP, rituximab, cyclophosphamide, prednisone, and radiotherapy. If there is association with HIV, you should treat HIV. This association with human herpes should treat each H8. And rituximab is a gold standard. Benjamin Castleman. That's Castleman disease made easy. Again, it's a rare disease discovered by the Benjamin Castleman disease in 1956. Who discovered lymphadenopathy, which is not lymphoma, it's lymphoma-like, but has a unique pathology. Divided into unicentric and multicentric. Unicentric is like Hodgkin disease, affecting only single group of lymph nodes, maybe in the chest, mediastinal group, maybe in the neck, upper deep cervical, lobe cervical, submandibular, maybe in the abdomen, mesenteric lymph nodes, and there is association with extra lymphatic associations affecting the skin with violaceous nodules and the eye, lacrimal gland. So it's like non-Hodgkin, it's like IgG4 disease. Divided into unicentric according to the group affected, and multicentric. Multicentric is association with two viruses, human herpes virus 8 and HIV, association with Puym syndrome and Tafro syndrome, thrombocytopenia, and Asarca fever, reticulin fibrosis, and organomegaly. David Fajgenbaum, don't forget this physician who had Castleman disease and started to fight alone his battle and won it. CT scan, PET-CT, MRI for staging of this Castleman disease, and there are criteria. More than 2 lymph nodes should be more present. Pathology should be specific for Castleman. Major criteria which is of Tafro syndrome and exclusion of infections, autoimmune diseases, and lymphomas disease of exclusion. The treatment is unicentric. Remove all this group of lymph nodes of annoying lymph nodes. Surgical is like non-Hodgkin disease, R-CHOP, which is rituximab, cyclophosphamide, and prednisone, and radiotherapy. If there is HIV, treats HIV by antiretroviral treatment. And if there is Puym, treat the Puym as Puym. Thanks for following us.